Good day, Professor Mel and classmates. I am Carmela Jane Evlior, and I will be discussing today social marketing for social mobilization and social marketing to mobilize public will. Let us have a recap of the previous discussions where social marketing and social mobilization were defined. In our Module 2, social marketing had a lot of definitions. It is defined as the application of marketing principles to sell socially desirable products, ideas, and practice. According to Kotler, it is the design, implementation, and control of programs calculated to influence the acceptability of social ideas involving consideration of product, price, place, and promotion. It aims to primarily influence consumer behavior for socially desirable products. It is also the application of commercial marketing technologies to the analysis, planning, execution, and evaluation of programs designed to influence the voluntary behavior of target audiences. Social marketing is a mindset in its emphasis on consumer needs and corresponding preoccupation with segmentation and research. It is more on thinking to filling in a customer's needs rather than of having a great product or lifestyle to sell. It is a process in its description of who marketers can control and modify the aspects of the four Ps. Social mobilization, as defined by McKee, is the process of bringing together all feasible and practical intersectoral and social allies. People are organized in order to enable them to collectively think and act upon their development. Social mobilization is also to assist in the delivery of resources and services and to strengthen community participation and sustainability and self reliance. This being said, it is the process of bringing together all societal and personal influences to raise awareness and demand for healthcare, assist in the delivery of resources and services, and cultivate sustainable individual and community involvement. In order to employ social mobilization, members of institutions, community partners, and organizations and others collaborate to reach specific groups of people for intentional dialogue. Social mobilization aims to facilitate change through an interdisciplinary approach. Now that we have recapped social marketing and social mobilization, we will now relate these two to public will for social change. Public will campaigns are organized, strategic initiatives designed to legitimize and garner public support for social problems as mechanism of achieving policy action or change. The goal of public will campaign is to alter the potential of a social problem in such a way that it moves from a small thing or issue into a much higher and structured profile and a concrete policy agenda. Public will campaigns are vital to policies because legislators or policymakers would be able to consider the public's point of view, concerns, and even outputs. Just like any activity, there will always be struggles. Public planners hurdle challenges such as beyond the ideology of individualism. Public planners' efforts may be criticized and delegitimized as rooted in politics or partisanship. By instituting change beyond the individual level, public will campaigners may be viewed with suspicion or greeted with accusations of politicizing otherwise scientific issues. What they are working on and pushing over may be seen as just self serving. The next is public opinion or effective public opinion. Since people have different and diverse stand on things, public opinion may be regarded as meaningless. This is according to Herbert Bloomer, who is known for his scathing yet insightful critique of the public opinion industry for its confusion in attempting to study public opinion by merely refining the technique of survey research. He added that public opinion was a mere display of terminal in its very expression, or never came to the attention of those who have to act on public opinion. He emphasized that public opinion is the expression of sentiment that reaches the systematic agenda of political decision makers through lobbying and other forms of communication, or indirectly through publics motivated to mobilize for political action. The goal of public opinion is to ensure that an organization's efforts to define a social problem and its solutions reach the ears and eyes of those with power to allocate resources and choose policy alternatives. This is the goal more than generating awareness or influence. The last challenge is community as mechanism of change. Individuals may make choices, but they do so from options determined by their environments. Even establishments like restaurants, grocery stores, or local media, schools, churches, voluntary associations, government offices, and other community institutions are actively involved in a change effort and shaping environmental, health related options. Individuals' choices will necessarily be affected. If these institutions are not participating nor reinforcing campaign themes and desired choices, efforts to mobilize the public will unlikely be successful. If there are hindrances to public will campaigners, there are also theories and models from allied fields that can help inform designers of public will campaigners. These are social problem construction, agenda building, framing, mass communication and social perceptions, social capital, and social marketing. Social problem construction. Public will campaigns begin with a social problem that needs to be addressed. Zastro posited that a social problem exists when an influential group asserts that a certain condition affecting a large number of people is a problem that may be remedied by a collective action. Our notion of what is considered to be a social problem or not is a product or something that has been produced or constructed through social activities as opposed to the objective conditions themselves. An example provided for this theory or model is the occurrence of young, poor, unmarried women having babies. It may not be seen problematic for some, but it is a fairly routine and expected biological outcome. It becomes a social problem only in the context of a particular chronological era and social structure when some influential individual or group provides a label to the phenomenon and claims that the condition is indeed a social problem. It is seen as a social problem due to the following factors. For a religious claims maker, there is moral decline in society and the need for stronger religious institutions. For public health claims maker, failed sex education programs in schools. For a, for a child psychologist, from the perspective of the child who will be born into a perpetual cycle of poverty. For a feminist scholar, it is the failure of a patriarchal setup that ignored the plight of women and children. And lastly, for an economist, it is the burden that places on welfare rolls and government subsidies in capitalist societies. Social problem construction also make use of typification and use of numbers and statistics to back up claims. Agenda building focuses on explaining the process through which some issues emerge and gain prominence in the media, court system, and or legislatures, whereas either issues never achieve public prominence. Obvious implications for public will campaigns by its emphasis on strategies that can be used to gain access to the public and systematic agenda. Framing refers to the persistent patterns of cognition, interpretation, and presentation of selection, emphasis, and exclusion by which symbols handlers routinely organize discourse, whether verbal or visual. Framing for access includes the use of such tactics, tying a new story with some anniversary of a historical event, touting a new breakthrough or discovery, linking a new story with a celebrity, finding an ironic twist in an issue, identifying a local angle to an otherwise national story, or linking a story to a holiday or a seasonal event. Before the field of mass communication enjoyed a renaissance in the early 1970s, some scholars concluded that media seemingly had little empirically verifiable impact on individuals and society. Agenda setting and spiral of silence are two theories significant to the study of public will. Agenda setting is research that is initially focused on the relationship between media coverage of issues and perceptions of issue importance among the general public. while spiral of silence is the people's willingness to express their opinions on controversial public issues is affected by their largely unconscious perception of those opinions as being either popular or unpopular. If individuals perceive that their opinion on a controversial topic is shared by a majority or is gaining momentum in the public sphere, they will feel confident expressing it in public. On the other hand, if individuals perceive that their opinion is held only by a minority or is discredited or unpopular, they may be reluctant to express it publicly. Social capital is an investment in social relations with expected returns in the marketplace. The core idea of social capital is that actors are linked and have the potential of communicating and exchanging resources of all kinds. It is a resource in the form of informal networks and a means to influence the public will. In social capital, we can also see that communities affect people's ideology. People tend to go along with the public will when they are invested. Examples of community organizations where members are invested are churches, neighborhoods, door to door campaigns, environmental issues like preserving water cleanliness, air quality controls. With social capital, it may be noted that people with less financial capital and more social capital can make powerful strides in social change regardless of financial status. Factors such as grassroots involvement, personal networks among activists and media professionals, and coalition building can compensate for meager financial resources if community residents understand the shared benefits of social change. Social marketing is the application of marketing developed in the commercial sector to the solution of social problems where the bottom line is behavior change. This is a tool for mobilizing the public will. Though it operates quite differently, it is a mindset in its emphasis on consumer needs and corresponding preoccupation with segmentation and research. It is a process in its description of how marketers can control and modify the aspects of the four Ps to induce change. Social change involves the transformation of collective behavior, culture, public policy, or social institutions over time. Social problems are not the same with one another as each is complex, culturally embedded, and multifactorial. These are the things to be considered in designing evaluations to measure social change. Public will campaigns are significant and have impact to influence effective public opinion, social norms, community structures, networks, individuals, perceptions of their political environment, and ultimately to achieve social change. Theories and concepts provided in this paper may be challenging to implement and complicated to evaluate, but with virtue of simultaneously operating on multiple levels of analysis and focusing on multiple outcomes, these are likely to be significant in creative or affecting meaningful, substantive, and enduring social change. That concludes my report, and thank you very much for your time. To facilitate discussion, I would like to ask the following. Which among the advocacy works provided in the Mobilizing Public Will for Social Change paper did you like most and why? Provide and narrate one social mobilization that mobilized the public will in the Philippines or in your area.